the HOD, our professors in attendance, my colleagues, good morning to you all. My name is Bakau Oyinloye Alli. The topic of my presentation is management of conflict in the pharmacy work environment. This is the outline of today's presentation. Introduction, type of conflict in pharmacy setting, conflict management, steps for conflict resolution. We look at some case studies and tips for preventing future conflicts. Let's start by asking ourselves, what is conflict? Conflict is a disagreement or clash between individuals or groups of people of differing interests, opinion, values, and goals. This is a natural part of human endeavor and can occur in various settings such as in workplace, relationships, communities, and even within oneself. Conflict can manifest in different forms, ranging from minor disagreement to more significant disputes. It is important to note that conflict in itself is not inherently negative. However, the way you manage it and resolve it, the conflict determines whether it is positive or negative. How does conflict look like? From the diagram, you see two people. It's like a struggle between two people or more. And conflict is often perceived in terms of winners or losers. Conflict means struggling between people with different ideas, beliefs, values, and needs. And conflict can also look like creative thinking, understanding all sides of an issue. When you try to understand from your own perspective, it may lead to conflict. Group cohesion or conflict can be a healthy debate. From the diagram above, you can see a lot of things going on in that chap's head. Thinking consciously about your choices when confronted with conflict. And you can also think of either you are assertive or cooperative with others. Therefore, conflict management is an important tool in management and leadership toolkits, and conflict can be used to increase effectiveness on the job. What is conflict in relation to pharmacy workplace? In the context of pharmacy workplace, conflict can be referred to as the agreement or dispute that arise among pharmacy staff members, patients or clients, or stakeholders due to differences in opinion, priority, expectations, and other factors. Fry and Fried, 1997. What are the types of conflict that can occur in pharmacy setting? One, interpersonal conflicts between colleagues, customer-related conflict, that is conflict between the pharmacist staff and their client or patient. Intrapersonal conflict, you can have conflict within yourself. Maybe it may be in terms of value, ethics, and others, and you are undecisive. This might lead to conflict. Organizational conflict might be a conflict between pharmacy staff and management in terms of rules, proceeding, and operations. Ethical and professional conflicts, role confusion, and communication breakdown. What are the causes of conflicts in pharmacy workplace? Communication breakdown, role ambiguity, workload and stress, differences in value or belief, resource constraint or power struggle. What are the negative impact or unresolved conflicts? Can decrease employee morale and job satisfaction. If an employee has something that is bothering him or her and is not well resolved, may lead to morale or job unsatisfaction. It can also lead to reduced teamwork and collaboration. Unresolved conflict can lead to reduced teamwork. Everybody will go into his own cocoon and will not collaborate with others. Poor patient care and safety, because the essence of pharmacy practice is patient care. So when there is conflict within the setting, it may lead to less or poor patient care, increased employee turnover. Persistent conflict might sometimes lead to employee leaving the job, and that may lead to turnover of employees. Damage to reputation or customer relation. What are the steps for conflict resolution? One, you must first acknowledge that there is conflict to be addressed. Also, you must gather information about the issue, collect fact and viewpoint from all parties involved, so that you know the fact. This will make resolution very simple for you. You must choose the right settings, let a neutral private space for discussion. You must also facilitate discussion. You must bring the parties together to discuss, encouraging open sharing of thought and emotion without blaming anybody. You must also identify the solutions. You must implement your decision, also follow up and follow through. What are the conflict management toolkits? As a manager or a leader, you must have some tools in your kit so that you'll be able to manage conflicts. Number one, you must be able to build trust. The reserve of trust can help team cope with disagreement and difficult issues. You must also know yourself and allow others to know you. Your conflict style infantry help your team members to understand their style of coping with conflict. This goes with training. You must train them on different areas of conflict resolution, and you must internalize it so that when you are dealing with them, they will also understand. You must also model yourself. You must walk the talk. Whatever you tell people, people see you as the mirror in which they assess your leadership quality. So you must model yourself, the skill you want others to adopt. You must also mind for conflict, allow people the opportunity to agree with you. You must help an healthy debate. What are the strategies for conflict resolution? One, we've mentioned it before, open communication, active listening, mediation, problem solving, compromise, and escalation. Conflict resolution. There are two dimensions of personalities. One, assertiveness and cooperativeness. Each of us falls along a continuum between these two personalities. One, between assertiveness and unassertive. Assertiveness is the extent to which you attempt to satisfy your own concern in a conflict. Cooperativeness and non-cooperativeness. Cooperativeness is the extent to which you attempt to satisfy the other party concerned in a conflict. Depending on the situation you are in and the degree of your own and other cooperation and assertiveness, you can consciously decide which way of responding might lead towards the most effective response to the circumstances. Culture also plays a significant role in how we handle conflict. Some cultures are generally more non-confrontational and prefer to avoid conflict or deal with it unless there is really no choice. For example, African culture does not allow us to argue with our elders. So even if you have issues with an elder, you prefer to keep quiet, not bringing it to the fore. We look at Thomas Kilman's conflict mode instrument of conflict resolution. There are 5 of them. Number 1 is competing. Number 2, collaborating, accommodating, avoiding, and compromising. We'll go into the details of these 5 models of conflict resolution by Thomas Kilman. we talk about the dimensions of people, that is the assertiveness and cooperativeness. The y-axis is assertiveness, that's concern for your own interest. On the x-axis, we have cooperativeness, that's concern for other agenda or interest. If you look at competing, it means win-lose. I'm right, you are wrong. I win, you lose. In collaborating, it's a win-win situation. Let's work together. Compromising means we win. You give some, you lose some. Let's find the middle ground. Avoiding, that's lose-lose situation. After you, no other. Accommodating, you lose, the other party wins. Avoiding, you can live well enough alone. You can be useful as many conflicts resolve themselves, even without intervening. But people involved are forced to find a solution without bringing others into the situation. Avoidance can be used to buy time. Delegation of conflict resolution frequently is a form of avoiding conflict. What of competing? Happens when people are highly assertive and uncompromising. When conflict is more managed using whatever power is available to prevail. If you have personal interest in a conflict, then you want to assert your authority. It is useful when you need to make a very quick decision, especially in a crisis situation. Take a decision in your favor, thinking it is the best for everyone. Accommodating. That's neglecting one's concern and interest in order to accommodate those of other persons. It is good for goodwill creation, to keep peace, preserve harmony, and when relationship more important than the issue at hand, you want to build goodwill with people, and you want to appeal to their to contribute to their emotional bank account, then you use accommodation. When do you use compromising? Finding a mutual acceptable solution to the problem that is somewhat satisfactory to both parties. That's the spirit of give and take, meaning that neither party entirely gets what they want. It is used to resolve important conflicts where you want both parties to have at least partial satisfaction. Compromising can be quite effective. Collaborating. Thought as two heads are better than one. It involves engaging other parties to find a solution that fully satisfies each of their concerns. It is often the most enduring and productive approach to conflict resolution because it's a win-win situation, but it also takes the most energy, the least interference from individual egos, and the greatest level of emotional maturity to achieve. Most effective when accepting ambiguity, there isn't always the right way. Let's note that which mode to use when conflict arises. There's no one mode that will be in the best for all situations. It depends on the goal you want to achieve and your willingness to cooperate with others. You have to pause and assess the situation before moving forward. As a matter of fact, being aware of different options and different responses will increase the chances of responding appropriately in case of conflict. When to use each instrument. When somebody is highly assertive, with low level of cooperativeness, you use computing. Quick, decisive action is needed, but important but unpopular issues are at stake, and where there isn't any right way, you use computing. You use avoiding for trivial issues when there's no chance of getting what you want. When the potential risk of confrontation outweighs the benefit of resolution. Other better places to resolve the issues are available. When do you use accommodation? Issues much more important to other parties when their interest outweighs yours then you concede. That's accommodation. To limit the damage of continued conflict, when you have an unresolved conflict and you want to minimize damage to the workplace, then you can accommodate each other. You use accommodation when you want to bank favor, goodwill, so that you can be paid back some other time. And also when you are in the wrong, you take certain decision and you eventually realize that you are wrong, then you retreat and accommodate the other party. When do you use compromising? When there is moderately important goal, but not worth potential disruption of more assertive modes. When there are two equal strong parties committed to mutually exclusive goal, expediency, backward competing, and collaborating. When do you collaborate? When both sets of concerns are too important to be compromised, when insight is needed from different perspectives, when there is increased others' commitment to solution and long-term issues. Let's look at this word from Thomas Pharm. He said, and I quote, "In a conflict, being willing to change allows you to move from a point of view to a viewpoint. This is a higher, more expansive place from which you can see both sides of an issue." Training and education is also very important. Emphasize the significance of ongoing conflict resolution training for pharmacy staff. Highlight the benefits of improving communication skills and conflict management techniques. What are the tips for preventing future conflict? 1, suggest proactive measures to minimize conflicts. Clear job role and responsibility. You must give clear delineation of job so that people will know their boundaries. Effective communication channels. In meetings, there must be full communication. When people don't have information, a lot of rumors will be going around. That may lead to conflict. Regular team meetings, feedback mechanism must be put in place for you to have feedback from employees. Respect for diversity. Diversity in terms of tribe, religion, language, and so on, to prevent conflict. We have some case studies here. Case study 1, interpersonal. Sarah and Alex are two experienced pharmacy technicians. They have been working together for several years. Recently, conflict have arisen between them due to differences in work approaches and communication style. Sarah preferred a systematic and organized approach, while Alex is more laid back and prefer flexible workflow. What's the conflict? The conflict has resulted in misunderstanding, delayed tasks, and a tense atmosphere in the pharmacy. The resolution. The conflict is addressed through a mediated discussion. Sarah and Alex expressed their concerns and viewpoints. They agreed to compromise. That's where you use compromise, by adopting a workflow that combines organization and flexibility. Regular team meetings are established to review work processes and ensure effective communication. Second case study is customer related. Emily, a pharmacist, encounters a frustrated patient named John, who claims that he was given the wrong medication by the pharmacy. Emily reviewed the prescription record and discovered that there was indeed a mistake. John is angry and worried about the potential health risk and he demands an immediate resolution of the issue. How do we resolve this type of scenario. Emily apologizes because he found out that he discovered that he has indeed made a mistake. For the mistake and explained the step that will be taken to rectify it. She involved the pharmacy manager, that is the head of the department, and offered John a clear plan for getting the correct medication promptly. Emily also discusses additional safety measures that will be implemented to prevent similar errors in the future. The third case is an organizational conflict. The pharmacy has implemented a new policy that requires technicians to take on additional administrative tasks. So pharmacy technicians are concerned that these tasks are taken away from their primary responsibility, leading to stress and inefficiency. What's the conflict in this? A group of pharmacy technicians voices their concern to the pharmacy manager, requesting a review of the policy. How do you resolve this? The pharmacy manager schedules a team meeting to address the concern during the meeting. The pharmacy manager explains the rationale behind the policy change and listens to the clinician feedback. A compromise is reached where the pharmacy technicians are given more responsibilities and put their mind at rest. Let's take a moment now to read this quote from Laura Hess and Martin. They are the authors of Leadership of the Line, Staying Alive Through the Dangers of Leading. Says, and I quote, successful leaders manage conflict. They don't shy away from it or suppress it, but see it as an engine of creativity and innovation. Some of the most creative ideas with one another, rather than position. The challenge for leaders to develop structures and processes in which such conflict can be orchestrated productively. In conclusion, of the 5 responses to conflict, that is accommodating, compromising, competing, etc. There's not necessarily one that is always correct to use. As a matter of fact, being aware of options for different sources will increase conflict vocabulary. If you will, your chances of responding in a way that solves conflict to everyone's satisfaction. Let us remember that managing conflict is not just about resolving disputes. It is about fostering an environment where everyone's voices are heard, ideas are respected, and challenges are turned into stepping stones towards success. These are my references, and I appreciate all of you for listening. Thank you, and God bless you.